Case 1. We have a study conducted to assess the effect of beta-blocker therapy in patients with acute myocardial infarction. The study found that 20 patients out of 90 who took a beta-blocker during the week prior to developing a myocardial infarction had a major arrhythmia event during hospitalization. In contrast, 30 patients out of 70 who did not take any beta-blocker developed a major arrhythmia. The question is, what is the odds ratio of developing a major arrhythmia in patients who took a beta-blocker compared to those who did not? The odds of an event are defined as the probability of that event happening divided by the probability of it not happening. The odds ratio is a measure of association that compares the odds of an outcome occurring in the exposed group versus the unexposed group. In this case, the odds of developing major arrhythmia in the exposed group is 20 divided by 70, while in the unexposed group it is 30 divided by 40. The odds ratio is calculated by multiplying 20 by 40 and dividing by 70 multiplied by 30. This results in an odds ratio of 0.38. Case 2. Hardy-Weinberg equilibrium describes a state in which genetic variation remains constant across generations in the absence of disturbing factors. This means that allele and genotype frequencies will stay stable over time. For this equilibrium to occur, several conditions must be met. These include a large population size, random mating, no natural selection, no migration, and no spontaneous mutations. If any of these conditions are violated, the population will deviate from Hardy-Weinberg equilibrium, leading to changes in genetic frequencies. Case 3. We have a patient with 20 serial pulmonary capillary wedge pressure measurements. Among these observations, the maximum value is 12 mm of mercury and the minimum value is 10 mm of mercury. Now, a new measurement of 26 mm of mercury is recorded. The question is, which statistical measure is most likely to remain unchanged? The correct answer is the mode. An outlier is an extreme value that differs significantly from other observations. In this case, 26 is clearly an outlier, since all previous values were between 10 and 12. Outliers can affect measures of central tendency such as the mean and median, as well as measures of dispersion like variance and standard deviation. However, the mode is the most frequently observed value, and it tends to remain stable unless the frequency distribution changes significantly. For example, if the initial data consisted of 9 values of 10, 6 values of 11, and 5 values of 12, the mode would be 10. After adding the value 26, the mode remains 10 because it is still the most frequent value. In contrast, the mean will increase because it includes all values. The range will also increase significantly, from 2 to 16. Standard deviation and variance will increase as well, since they are sensitive to dispersion and outliers. Case 4. A study is conducted to assess treatment efficacy in patients with heart failure. A total of 450 patients receive either a medication or a placebo for 2 years. Neither the patients nor the physicians know who is receiving the drug or the placebo. This setup is known as double blinding, and its primary purpose is to prevent observer bias. Blinding is used to eliminate the influence of expectations from both the patient and the researcher. For example, if a researcher believes that a treatment is effective, this belief could unconsciously influence how outcomes are interpreted. Other options to consider include beta error, which refers to concluding that there is no difference between groups when one actually exists. This is a type of random error, not bias. Recall bias occurs when participants do not accurately remember past exposures, and it is most commonly seen in case control studies. Effect modification is not a bias, but rather a real phenomenon that should be analyzed, not controlled. Selection bias occurs when the study population is not representative due to how participants are selected or due to losses during follow-up. Overall, the key concept here is that blinding helps prevent bias and ensures more reliable study results.